for today's webinar on juvenile reentry in concept and practice. My name is Leah Kane, and I'm with the National Reentry Resource Center. We have some truly fantastic speakers participating in this webinar today, but before we turn this over to them, there are just a few housekeeping matters that I'd like to go over. After our presentation today, there will be time for a question and answer session. If you'd like to ask a question, please type your question into the Q&A panel on the bottom right-hand corner of your screen. Please feel free to submit your questions throughout the webinar, and we will get to them towards the end after we finish the presentation. We are going to do our best to get to everyone's questions this afternoon, but please understand this is a very large webinar. At the moment, we have almost 300 people participating in the webinar. We may not get to your question, but we're going to do our best to get to as many as possible. If you encounter any technical or audio problems during the webinar, there is not a whole lot we can do to resolve individual technical problems that may come up. Unfortunately, there may be issues due to firewalls or connection speeds, and just any number of problems that might come up. But there are a couple of different things that we can do. The first is oftentimes people find that if they log out of the webinar and log right back in, that the problem might resolve itself. But if that doesn't work, you are also free to call WebEx Technical Support. Their toll-free number is 866-229-3239, and we'll put that number up on the screen for you in just a moment. But in case there are technical problems we can't resolve today, we are recording this webinar. The PowerPoint slides themselves would be available on the website of the National Reentry Resource Center later this afternoon, and we'll post that link for you as well during this webinar. But we will also have the actual recording, including both the slides and the speakers, hopefully available by the end of this week. And you'll all receive, those of you who have registered for today's webinar, you will receive an email when that recording is available on our website. So I'd like to give you a moment's background on the National Reentry Resource Center. It's authorized by the Second Chance Act, which passed Congress in 2008. Last year, in October of 2009, the U.S. Department of Justice selected the Council of State Governments Justice Center to launch the Resource Center in partnership with a very broad coalition of organizations working to improve entry from prisons, jails, and juvenile facilities. We are working very closely with the folks at the Department of Justice, including both the Bureau of Justice Assistance and the Office of Juvenile Justice and Delinquency Prevention, to develop resources like today's webinar. We are very grateful to BJA and OJJDP for their support of today's webinar, which is first of several that we plan to do this year on subjects related to youth reentry. In the webinar, I'm going to show you a few links that you can use to learn more about the Resource Center and to get connected to our monthly newsletter. We hope that many of you will be able to join us in our future webinars. In today's call, we are joined by Thomas Murphy, who is a state representative with the Office of Juvenile Justice and Delinquency Prevention. We're very grateful for Tom for making the time to join us today, and I'd like to turn it over to him for some greetings and to tell you more about our other speakers today. So, Tom?
Thank you, Leah. On behalf of Acting Administrator Jeff Slowankowski of the Office of Juvenile Justice and Delinquency Prevention, I want to welcome everybody who's attending this webinar. As Leah said, one of several webinars that the National Resource Reentry Center will be hosting over the next several years, so we're excited about that. Before I introduce our distinguished speakers this afternoon, I just want to share with you all exciting news that came out of our first meeting of the new administration of the Coordinating Council for Juvenile Justice and Delinquency Prevention. We just had our first meeting yesterday, as I said, of the new administration. The Coordinating Council is made up of 9 federal agencies, secretaries, as well as 9 practitioners who come together to set policy and for OJJDP. Exciting news came out yesterday. It was actually chaired by Attorney General Eric Holder. We had 4 cabinet-level secretaries in attendance amongst others, but they said and they voted on 4 issue areas that the council will be coordinating over the several years. And I'm pleased to say juvenile reentry is one of the 4 areas that the Council is going to be focusing on. There is a lot of support from the Attorney General on reentry, particularly juvenile reentry. We have a lot of interest from our federal partners as well as the practitioners in this area. So we are excited with the Second Chance Act, working with the Bureau of Justice Assistance on the adult side, but the reentry issue is top priority for the administration as well as the coordinating council. And just that you also know that 3 other areas we're going to be focusing on are going to be tribal youth issues, disproportionate minority contact, as well as education issues for at-risk kids and truancy. So that's where we were at with the coordinating council, and I was pleased to just find that out yesterday that reentry made it to the top 4. Now I just want to briefly introduce our speakers. We have Dr. David Altschuler, the Principal Research Scientist at the Institute for Policy Studies at Johns Hopkins University. Dr. Altschuler was the Project Director and Co-Principal Investigator on the Intensive Aftercare Project that was from OJJDP many, many years, about a decade, if not more, ago. I worked closely with Dr. Altschuler on that project, currently working with the National Reentry Resource Center as well as does a lot of work with the Department of Labor on the 3rd round of funding for the reintegration of the ex-offender initiative. Dr. Altschuler holds a Ph.D. in Social Service Administration and an M.A. in Urban Studies, both from the University of Chicago. Our next speaker is Shay Bilchik. He's the founder and director of the Center for Juvenile Justice Reform at Georgetown University Public Policy Institute. The center's purpose is to focus the nation's public agency leaders in juvenile justice reform. Shay Bilchik has been the administrator of the Office of Juvenile Justice and Delinquency Prevention. I'm sure many of you will remember Shay, as I do, since he hired me back in 1999. So further ado, I want to turn this over to Shay to get the webinar moving.
Thanks, Tom, and thanks to both you and Leah for your opening comments. I want to also take the time to thank the National Reentry Resource Center and OJJDP and BJA for the leadership they've shown on reentry issues, both in the juvenile and adult areas. It's a very important topic. I want time to welcome all of you on this call. I think we have well over 200, probably at this point over 300 participants. I appreciate the interest that you've shown in reentry, both either directly through the involvement with the center or simply logging on to this webinar. When I talk about the operation of the juvenile justice system in this country and our 50-plus states and territories in the District of Columbia, I generally think about 3 spheres of work that we engage in. One is around the entry of young people into the system. It's about the period of time that a young person is involved in the system, including whether on probation or committed into a residential setting. Third is their exit from the system, that period of transition back into family, back into community. Many instances, as we see with this population, into adulthood, or without supervision for a short or longer period of time. So on call, present someone I consider to be one of the country's preeminent thinkers on this issue, David Altschuler. We're going to cover the framework of how we can do this work better as it relates to that 3rd phase, that reentry or exit phase. It's work that uses a broader, more holistic lens approach this work. It plates the importance of having key stakeholders committed to the work, of using an ecological cross-systems model, and Tom's announcement about the Coordinating Council certainly fits into this scheme, having the Secretaries of Labor and HHS and Education and the Attorney General together committed to reentry for the work that we want to do in reentry, which cuts across these different systems, as well as the more meaningful role, I think, that we contemplate for the community writ large and the family as an entity that these kids go back to, that meshed in, and hopefully in a positive, healthy way as leave our system and move on to adulthood on their own. So Dave will explore these different dimensions of this framework today. And as Leah indicated, while today gives us the broad brush, we expect over the course of time through the Reentry Resource Center to begin to drill down into more detail on specific subset issues that the field considers to be of importance. So with that said, I'm going to turn it over to David, and I look forward to the presentation, David, and then being involved in the questions and answers.
Thank you. Thank you, Tom, and thank you, Leah. I'm much appreciative of having this opportunity to address everybody. I have been engaged in work on reentry. We used to call it aftercare. Some people call it reintegration for about 20 years now. And we've learned a tremendous amount over that time frame, and also from work that was done earlier. It's really a very exciting time that we're in now, given that there's obviously a very renewed focus and interest in reentry more generally, and juvenile reentry in particular. So this is really a great opportunity, I think, for all of us to take what we've learned, apply it in the world of practice, create new information and new evidence so that as we go forward, we can begin to sort of further refine and improve upon what we're doing. And it's just really quite a very opportune moment and interesting time for us to be engaged in this kind of work. Let me say, just as a way of sort of introducing this, that uncover this more in terms of the breadth of information than the depth of information. One of the topics or issues that I discuss, most definitely a great deal more time could be spent on them. And one of the challenges in a presentation like this is being able to, only scratch the surface of a number of very, very important issues. So in a sense, this is really Juvenile Reentry 101, if you think about it. I'm fully expecting that as we go forward with the federal interest through the Second Chance Act in this subject, and also with the work of the National Reentry Resource Center, that there are going to be numerous opportunities as we go forward to get into much more detail in a number of the different topics and issues that I'm going to touch upon this afternoon. So keep that in mind. I know that there will be a desire on the part of some to get a lot more detail about some pieces of this, but given what we're trying to accomplish today and what I want to cover, unfortunately I'll have to, in instances, not get into the detail that I think you would like. All right, the first slide that you're looking at right now essentially starts off identifying key dimensions of promising practice. And the reason I like to start in this way is because I think that this allows us to begin to refine how it is that we're going to ultimately proceed in bringing about change. And to some extent, you can apply this to really other kinds of change as well, not just change as it relates to juvenile reentry. What you can see is that there are 5 dimensions to this promising practice perspective. The first one is evidence-based research-driven interventions. And what I want to say about that is we are learning a tremendous amount, certainly within the last 5 to 10 years, as it relates to issues like adolescent development, neuroscience, and brain development. We're learning a tremendous amount about trauma-informed intervention, post-traumatic stress, what happens with exposure to violence, and also in terms of very age-specific types of interventions. We really have come a long way over the 30 years that I've been involved in juvenile justice and corrections in knowledge base. The problem, I'm sure you know, is that what we have learned in terms of evidence does not always work its way into the world of practice. And in fact, in some cases, what we see in practice is actually inconsistent with what we know the evidence says. It's very, very important for us to basically pay close attention to the evidence and to be involved as we go forward in creating new evidence and improved and refined evidence, so that as we go forward, we can base what we're trying to do with juveniles in terms of reentry, in terms of a variety of other types of interventions, on what offers us the best hope with regard to reducing recidivism, that is public safety, but also in terms of improving the circumstances that they confront. And those things are obviously very related. You can't really think about public safety without thinking about what kind of circumstances they find themselves. And so we really need to be thinking about public safety, and we need to be thinking about their functioning and their ability to manage and cope, because all of those things are interrelated. So from an evidence-based perspective, we need to draw on what we have learned. And one of the things that I'm going to talk about shortly, that the evidence over the last half dozen or more years is increasingly pointing to, is cognitive behaviorally oriented intervention. And also the evidence is increasingly pointing to the fact that punishment alone is inadequate ultimately to bring about a public safety benefit and to help to improve the functioning of these young people and their families and their communities in our system. So from an evidence-based perspective, we really are learning a lot. In connection with that, we all know that it's about being able to collect information, analyze data, think about from an implementation perspective and what some people refer to as a treatment fidelity perspective, exactly what it is that we're doing with whom and under what circumstances. Because it's only through that type of a paradigm that we're ultimately going to be able to mount the strongest case from an evidence-based perspective on what is ultimately going to get us to where we all want to go, which is a combination of improved public safety and improved functioning of these young people. As I've said, these things are interrelated. So in terms of evidence-based, very important. Second dimension has to do with structural characteristics, various features that we see in the different jurisdictions that we operate. A very key aspect of what we need to be thinking about in terms of what we're able to do or not do by way of reentry. For example, in some places, furloughs are prohibited. In some places, there can be no home passes or day release. In some places, access to the community around which the correctional facility or program is located is limited or not available at all. And in other instances, there's very little access by anyone from outside the facility into the program itself. So if we've got prohibitions or limitations or restrictions that are imposed along these lines, obviously that offers a very major constraint in terms of what we're going to be able to do. There are other kinds of characteristics and features that we need to be thinking about as well. If we're thinking about young people who are coming out of and ultimately returning to urban versus rural areas, if we're thinking about facilities or residential programs that are relatively close geographically to where they're going to be, where the young people are going to be returning, or very far away, another major characteristic and features. So you can imagine, of course, that there would be a long list of these characteristics and features, some of which are imposed statutorily, others of which find themselves in rules, regulations, procedures, and in terms of administrative requirements. And we're going to have to take very careful accounting of what these things are, because as I talk further, what you're going to see is that some things are going to be very difficult to accomplish unless there are adjustments made, or at least a rethinking of some of these characteristics and features, because they offer us the ability to either go forward and do in the way I'm going to talk about it, or pose some really major constraints. So some examples of what that would be. As far as the third dimension, which is also a very, very key aspect, of course, has to do with personnel, leadership, and training issues. With respect to personnel, let me just say that in many of the jurisdictions that I've worked, what we found is that the folks that are being called upon to provide certain kinds of services are really not necessarily qualified, knowledgeable, experienced, and in some instances, it's not even what they want to be doing. So from a personnel perspective, we need to take a very close look at the qualifications and the competency and the skill set that we've got for folks for whom there are various expectations about what it is that they're going to be doing that they may not be in a position to do. Now, that relates as well to training. We know that in various places, when resources start to get very thin, that oftentimes one of the first things to go is training. So what can happen is that we've got staff or we've got other people that are involved in the enterprise who get little to no training. They get training, but it is substantively training that doesn't directly relate to some of the things that I'm going to be talking about for reentry. So training is another piece of this, and we really have to pay attention to personnel and training, because even if we have everything else lined up properly, if we don't have the appropriate personnel and training to actually carry this thing out, we're going to have some real difficulties in terms of implementation. Another piece of this is leadership. And by leadership, what I'm referring to is that the folks, the administrators, the directors, the senior managers really need to stand behind this thing. We know that in many instances it just takes one high-profile, high-visibility mishap, and we can potentially jeopardize everything that we're doing. Even if what we're doing works 98 times out of 100, it only takes 1 or 2 times, and all of a sudden we can have things that are stopped, things that are prohibited, and the fact of the matter is that we may know that in many instances that is exactly what we wanted to do, but there was a mistake, there's a correction that needs to be made, there's an adjustment that has to happen. And that's where I think leadership comes in. We need to know who our champions are. We need to know where we're going to get the support, and we have to have our senior managers stand behind us. And we need to know that they're going to be there standing behind us, because obviously this kind of work where there is the potential for problems, and there is the potential for things to happen that, if we're not careful, may potentially jeopardize the entire effort that we're involved in. So we really need, among our leaders and among our champions, a great deal of support. For those who are risk-averse, corrections is not a very good occupation to be in, because we know that there are risks that we run. In terms of the fourth edition, I'm going to get into much more detail about overarching case management shortly, but I simply want to bring that up as another key dimension. The point about all these dimensions is we've got to be assured that we've got, or we're attention to these various dimensions, because even if we've got some other things going for us, if we have lapse in any of these areas, or we've got some real difficulties in any of these areas, we may have difficulty in terms of actual implementation, and we may have difficulties in terms of, as I indicated earlier, something that we refer to as treatment fidelity and integrity. The last dimension that I want to mention is about both the agency collaboration, which also embraced by it is the notion of service integration. I think it's very clear from a reentry perspective that we're going to have, and we're going to need to have, multi-agencies and cross-system collaboration. And when I say collaboration and service integration, I'm not just talking about improved communication. I'm talking about a level of collaboration where we do what it takes to get us all on board, that we have some basic agreements about what we're trying to accomplish, who's going to be doing what, so that all the agencies and the systems and the different services that I'm going to be talking about shortly are going to really be able to operate in a very integrated fashion. So I'm not just talking about communication, although communication is an important early step, but ultimately it's about cooperation, it's about coordination, and then ultimately the highest form of it is collaboration. And that really is going to require cross-agency partnership. It's going to require, in all probability, state and local entities, the public and private sector, volunteers, mentors, the faith-based community. So the collaboration is a very essential component, particularly when we're thinking about something that would embrace both pre-release and post-release. In terms of a definition, what I'll do for you is just sort of draw out what I mean by reentry. Now, the truth is that in some places the term aftercare is used interchangeably with what you're seeing in front of you now for definition of reentry. But in other jurisdictions, aftercare can have a statutorily specific definition that in some instances relate only to the post-reentry effort. In other words, it really doesn't focus on what happens pre-release, pre-reentry into the community. And therefore, I tend not to use the word aftercare too much just because, as I said, in a number of jurisdictions, aftercare has a very precise meaning, and in some of those places it really means what happens after release. And what I'm talking about in terms of a broad definition of reentry, or a term that actually prefers somewhat more, reintegration, it helps us to sort of keep our focus on the fact that we're talking about what's going on pre-release while juveniles are out of home in either a correctional facility or perhaps an alternative residential program of one sort or another, or maybe foster care, or maybe a therapeutic community. But we're talking about what happens during the time that these people are placed out of home. It seems to me that that is the very first aspect of the definition that we need to be clear about. And I'm not talking about just what happens shortly before release to the community, where in some places we hear the term discharge planning occurs, or pre-release planning occurs. I'm really talking about across the board what is going on during the time frame that these juveniles are in these residential facilities or in these correctional facilities. And the particular focus of this aspect of the definition is about what's being done to prepare both the young people, the families, and communities that they're going to return to for their reentry back. And unfortunately, in many instances, what we found in the correctional facilities and in other kinds of alternative residential programs is that preparation specifically for where they're going to go back is not what happens. It tends to be more generic, to be not necessarily specifically focused around exactly what they're going back to. And in some cases, staff within those facilities are not even very clear about all the details, or some of the information they have turns out to not be very accurate. So in terms of preparing these young people for reentry into the community and to be thinking about what's going to be necessary with regard to their family situation and their housing situation, in terms of education, in terms of potential for mental or substance abuse treatment, we've got to be focused very, very early on as to where they're going to be going back. Now, I recognize that may change. It may be adjustments over time, but that does not mean that we do not need to keep very much within our line of sight exactly what it is at that given moment we're thinking about, because that should be informing the way in which we're intervening and dealing with them when they're in the facility for the entire time. So that's the first part of the definition. The second part of the definition, which is related, talks about establishing all of the links with various individuals and groups and organizations in the community that are going to be in a position to address known risk and protective factors. And that really needs to be started very, very early. In fact, as early as possible. There are many places that talk about that happening during that discharge planning phase that they do during the latter part of being in the facility. And the problem with that is oftentimes that's just too little too late. Particularly when we've got a high risk for reoffending young person who's got a lot of complicated high-level needs. We've really got to get started on this a lot earlier. The last thing we need is a waiting list, and the last thing we need is to go into the community without having begun to make all the connections, get all the understandings, and that has to happen very early. And I'd argue that that really has to happen not during a few weeks before planned release, but at the very, very beginning. Now, once again, it may well be that will change. That may need to be revised. There's going to be the need to do some reassessments in this regard. But nonetheless, we've got to start this very very early. The third aspect of the definition relates to really the part that's more post-release, that is back in the community. And this has to do with folks regarded as essential for community corrections, and that is ensuring the delivery of both the services as well as the proper amount of supervision back in the community. And the reason for this particular aspect of the definition is because it's all too common that we know that in many places what we've seen is great degrees of supervision, but for one reason or another, the service provision and support side has fallen far short for various reasons. We also know from the research, from the evidence, that when all we're doing is providing supervision, and in many instances perhaps too much or the wrong kind of supervision, in the absence of anything else focused around services and risk and protective factors, that in many instances what we mean is not only is there not improvement, but actually things get worse for various reasons that I will explain shortly. So bottom line on this definition, and this is really the thing here with this definition, there's three parts. I'm talking about all three parts. And even if we've got a correctional facility or a residential facility that's very far removed, that maybe is far removed and out of state, it seems to me that there's really no substitution for our concern about these three aspects of reentry. And we need to be thinking about various ways that we can proceed with reentry, even if there's large distances, even if we're talking about going back to different communities, some of which have more resources, some of which have less. We've got to be able to think about what that's going to take and what we're going to do if we're really going to be serious about doing reentry. So you can see from the bottom of this slide, what's sort of highlighted here is that both the facility and the community have a critical role to play in reentry. It does us very little good if we do a phenomenal job while these juveniles and these young people are in facilities, and then when they go back out in the community, that's the end of it. It is equally problematic when potentially we've got some options in the community, but if they're in a correctional facility and they're there for a relatively long period of time, they actually may experience more setbacks and may have even more problems than they did when they went in, and that then has to be handled by folks back in the community, making that situation even more difficult. So those are the reasons for the three parts of this definition, and I would just urge you to keep in mind in terms of what you're doing or thinking about as you go forward with reentry. The next slide that you're looking at essentially shows what I'm calling the integrative continuum. You can call this a reentry continuum if you like. I've been known at times to say that this represents a aftercare continuum, because as I've indicated already, I tend to use these terms somewhat interchangeably. What you can see in these three spheres is that we've got the blue one, which represents the facility, the green one, which represents what I'm referring to as the transition. To the left of the line would be the transition out of the facility. To the right, and still in the green sphere, is the transition into the community. And then longer term, we're talking about what's going on back in the community. And the things that you'll notice in these three spheres is that they're overlapping. And of course, that's the reality of what we face. These things are all parts of these phases are overlapping. And what I want to now do is show you another slide. And what I've here is I've sort of pulled apart the three phases. And what you can see to the left, under what I've called institution, you could also call that residential facility or out-of-home placement. You see it says pre-release planning. So what I'm thinking about is that we've got to be thinking about pre-release planning at the very beginning. And by doing that, we can begin to inform what is that we're actually providing to these young people while they're in the facilities or in the institution, so that when we get to the latter part of their being in the facility, during what sometimes is referred to as charge planning, that we actually finalize that planning. We should not be, in my view, beginning it at that point. We should be finalizing it at that point. So what you can see in this slide is that I've separated out. We've got this kind of transitional phase during the latter part of being in the institution or facility, and during the initial part of reentry back into the community. And you'll see on the right side that there's a box that says community and family. And I think that increasingly what we're recognizing is that the family is an absolutely integral part of what we have to deal with. And that means in terms of what the family offers by way of opportunities and support, and also in terms of what we may find in some families to be problematic or challenging or difficulties. In either case, we need to be thinking about that, because we know that in many instances these young people are going to be interacting with their family. And even if they do not go back to live with their family, that doesn't mean that they're not going to have interactions with their family. So there's all kinds of very good reasons why we need to be thinking about what family brings to the table. And the only way we can begin to do that is to interact with them and to have them as involved as is possible, as early on as possible. And typically what that's going to do is involve the people and the folks that are working in the community who can be the major contacts and the point of contact for the family, and hope to be the intermediaries with the folks in the facility. Because otherwise, folks within the facility and the institution tend to be understandably preoccupied with what goes on inside. And so there's lots of reasons why, even with the best of intentions, they oftentimes don't focus on family in the way that we would like. They don't focus on the community in terms of potential volunteers or mentors or even community providers. So we've really got to get on board the folks that are working the community early on, and oftentimes that will be a community aftercare, I'll say community aftercare worker who's going to be the point person. It may be a probation officer. It may be a parole officer. It may be a parole officer or a probation officer working in concert with other providers or other workers and volunteers and possibly family members. But the point is that we've really got to assign this responsibility to somebody. And it needs to happen very early on, because frequently what will occur is that no one who's working in the community, either because they're restricted from doing it, or they're not compensated for doing it, or they don't have the time to do it because it's not built into their workload, it doesn't happen at all. So it's left up to the groups in the community, the family members, to pretty much try it on their own and see what they can accomplish. And quite honestly, I don't think that oftentimes is a very successful strategy. In terms of the next slide, what you'll see is I've now just taken the same slide that you were looking at, and I've just adjusted the language a little bit. So you can see now there's something that I'm referring to as the institutional, we could say the facility transition, still inside but getting ready to leave, and the community transition, that's at reentry or at post-release back into the community. The next slide, what I've done is I've alphanumeric coded these separated, I'll call them now stages, okay? We had 3 overlapping phases. Now what we can see are, in front of us in this slide, we can see 5 mutually exclusive stages. And there's a method of my madness, which I'll get to in one second, which is to very carefully begin to pull apart, because from a workload point of view and from thinking about collaboration, who's going to be doing what when, it's going to be very important to carefully pull apart, to dissect, to disaggregate these mutually exclusive stages, to figure out exactly who's going to be doing what at which age. And by thinking of it in that way, we can begin to identify and hopefully create a strategy and approach in which reintegration truly is reflected both in design and ultimately what it is that we're going to implement. What you're looking at is essentially a matrix, a chart, in which I've taken the 5 stages, and 5 stages you can see are rows. Stage 1 is the first row, stage 3B is the 5th row. And then you can look at the columns, and what you'll see in the columns are an example of the partnering agencies or the organizations or the groups or the staff people. I could have added more columns, and I could have put family. I could have put the faith community. I could have added as many columns as there would be potential partners, both public and private sector, volunteers, paid staff. We could play this thing out as many different individuals and groups that are involved. If you look at the first, which has some subcolumns, you'll see I have facility staff with a broken line. The reason for that is we know that in many instances within residential facilities or in correctional facilities that there's oftentimes a great divide between the staff who provide child care or security, the staff who are involved in education, those who do clinical services, those who provide support services of various sorts, cooking, for example, recreation staff. And in many instances, unfortunately, we've got facilities where there's really not a very unified way of thinking about how you want to interact with these young people. And it seems to me that if that's the case, there is this division, we're already starting out on the wrong footing. And so what I've done in this one example under facility is to just illustrate that you might be thinking that one of these columns would be direct care staff. Or security staff. Another column might be education. A third column might be clinical. And it turns out that in a number of facilities, it might well be that some very fine things are happening with a lot of real success and accomplishment by way of education and counseling around either substance abuse or mental health, or dealing with family issues. But the problem is that the staff that they spend most of the time with are not really part of that, have in cases no understanding or even an appreciation of it. And in some cases what ends up happening is what we see in our young people is what they're reacting to is much more what it is like in what some people refer to as the living space. And even if some good things are happening with clinical staff and education staff, it may be that the greater influence might be from what's happening in the living quarters, and that may be where they spend much more time. In that instance, we need to be thinking about how we can bring the different units within the facility together so that we can hopefully be on the same page, reinforcing each other. And it's just the facility part. When we think about the community probation or parole officer, what their involvement is going to be. In some instances, there's a separate person that might be referred to as a transition coordinator. There could be some providers, specialty providers, community mental health, substance abuse treatment provider, volunteers, family members, mentors, the faith-based community. We need to be thinking about, from a collaboration point of view, exactly what our expectations are about how people are going to work together. And have we, if you go back to that first slide, are there impediments and barriers that we've got built in that don't allow that to happen very well? They, in fact, present such serious constraints that, for all intents and purposes, it's an impossibility. Now, with this kind of a matrix, what you can do, you can think about a particular stage, and you can sort of, if you're from you can think about this in terms of a program design tool. You can think about it from coming up with an operational plan, a policy and procedures, guiding actual implementation. You can even think about it as a way to begin to evaluate what you're doing or not doing, or how well you are. Across a given stage, with all of the providers and major divisions of staff within a particular organization, what are they being asked to do with respect to various pieces or components of the intervention or the sanction? What we might see is that within a given stage, there are multiple people, group, organizations in any one time. And we ask ourselves, when that's happening, are we operating in tandem with one another? Are we contradicting each other? Do we not know what each other is doing? Do we not are we amenable and thinking that what's being done by the organization or group makes sense or is actually helping what we're doing? I mean, it seems to me that within a given stage, we need to be thinking about who's doing what. When there are multiple organizations or people, it may be fine. It may be an indication of a duplication of service, perhaps. It may actually be a very good team approach. So we've got to be able to assess the extent to which it's doing what we want to do. Is it an unnecessary duplication, or in fact something that offers us some real benefit in terms of teams? We find that certain columns with regard to a particular state are blank. There's nothing in it. Folks aren't doing anything. And we say to ourselves, maybe it's not a very good idea. Maybe there's certain things they can be doing. They don't necessarily have to be at the facility, certainly pre-release, but that doesn't mean they can't be in contact. That doesn't mean they can't be dealing potentially with folks in the community, with family members in the community. So across any one stage, I think you'd want to consider all the different options. Now, within thinking about a particular column, one organization, group, provider, or interested individuals, the question is, are they involved in multiple stages or not? Could they be involved in multiple stages? And I think a very pure, well-organized and executed reintegration perspective, you want to be able to get folks involved very early on. But as I said earlier, there may be some things that get in the way of doing that. For example, if it's a community provider, they may be told that's already being done by folks in the facility, and they actually be providing a similar service in the sense that it might be substance abuse treatment, but it may have absolutely nothing to do with the substance abuse treatment that these young people are going to get when they go in the community. That, to me, is a huge disconnect and a very big problem. And I could play this out in a couple of different ways. I think you would get my point. So I suggest to you that you use matrix. Either, if you're in a design phase, to think about it that way. If you want to assess what you're doing now, you could think about it that way. But to use this matrix and then go to the slides and begin to sort of sort out exactly what the approach and the division of labor is going to be, and then I think you'll be moved in a much more reintegrative direction. What I've done now in this next slide is offered you those three spheres again. What I've done now is I'm focusing on a number of major domains in which we find factors that may be predictive of reoffending. And I think we know that we've got to be focusing on risk factors, we've got to be focusing on protective factors. We need to be thinking about a variety of considerations as these young people move from facility into transition and back into the community. And this is just a way of illustrating that we've got to get all our ducks in order. We've got to get everything lined up as best as we possibly can so that when we've identified risk factors and the protective factors, that we can begin perhaps in slightly different ways, but all still in some concert with some consistency, focusing on some of these same things. The factors are not going to change. And as these young people go from facility to transition to community, particularly when they're high risk and high need, it's going to be incumbent on us to provide as much consistency as we possibly can, and that does not happen by itself. So that's simply illustrated by this slide. What I've done in this slide is just offered you 7 major domains, and those of you who are very familiar with all kinds of tools and inventories and various ways to do assessment and screening will recognize these, and you know that you can this could be 14, this could be 21 domains. For purposes that are just convenient for what I'm trying to do now, I've just found it easy to break it into 7. The fact of the matter is that within these 7 domains, there are both risk and protective factors. And from an assessment point of view, what we need to be thinking about within each, what are the risk factors? What are the protective factors? Because these are the very essential elements that we're going to want to focus on as we go from stage 1 to 2A to 2B to 3A and pay very close attention. So I'm not going to go into more detail on these domains. Obviously, any one of them we could spend a great deal of time in, and I hope that there'll be more opportunities as we go forward through webinars and through other means to talk more about each of these. With respect to the three years again, I just want you to sort of be thinking about it in a way that there are services and there's tasks and there's practices and there's functions that we think about in each of the phases. And what you see in the slide in front of you is a way to capture a range of different functions and services and practices by phase. Again, what I'm trying to do and what I have found very useful in the various places that I work with is to think very concretely about who's going to be doing what in which way to produce what kind of result. And if we're thinking about that collectively and use some of these items within this slide, I think that we're going to be in a much better position to be able to truly implement a reentry effort that's going to be very collaborative, very service integrated, and very holistic. Okay. The reason for this slide is I like it because what it captures for me is the fact that what we really want to accomplish over time is a gradual reduction in the more formal mechanisms of social control and influence, and an increasing emphasis on various informal mechanisms of social control. And it would, clearly involve family. It would involve mentors. It would involve friends and peers. It would involve other adults in the community and other providers, agencies that are in a situation where they could provide specialized interventions, particularly around things that may relate to substance abuse treatment where it's needed, mental health services where it's needed, thinking about housing, thinking about education. What we know is that over time, it's going to be other systems without the input of justice that are going to be increasingly taking more and more of a direct role in things. And so it seems to me that it only makes perfectly good sense to start that as early as we possibly can. In some instances, it's as much about getting those organizations, groups, and interests involved early on and used to and acquainted with young people as about anything else, because they may tend to see these young people as, at least while they're not back in the community, as not their problem, not responsibility. And it seems to me we're in a position to begin to break that down more and more to the extent to which we can get them involved in various ways early on to begin to be there and to get more knowledgeable about who these young people are, what's going on in their lives, what's going on in their community, and what's happening with them in these facilities. Facilities that frown upon the involvement from the community. I think when that happens, we know what we're going to need to be working on. And frankly, in a lot of instances, there are all kinds of reasons that are raised as to why you can't have access and why people can't come in. But the truth is that there are many other places that have realized that there's all kinds of ways to be full, to have controls, to maintain safety, and under carefully controlled circumstances, it can happen. So, I want to say to you that I think it's very, very important that we gradually get more and more involved, all the forces from the community that are going to be playing a role, because these are their kids as well as our kids and as well as young people who are going to be in correctional facilities. And so I particularly like this, I call it, just because it sort of captures that reality. From an evidence-based building block point of view, I want to just very briefly touch upon continuity of care, cognitive behaviorally oriented approaches. We talked a bit about staffing training, and finally, overarching case management. These, I believe, can be regarded as foundational building blocks. These are things in terms of reentry and reintegration that I think we're going to have to pay a lot of attention to in terms of what is that we're doing with our young people, from the point at which they get admitted to the out-of-home placement, through their transitional phase, and then back in the community. Very quickly, continuity of control simply refers to the fact that for a number of these young people, we've got to be very careful that when they leave a highly structured and controlled setting, that they're not immediately thrown off the end of the earth. And we know that in some instances, that's exactly what happens. Particularly with a high risk for reoffending, high need young person, it seems to me that's a prescription for disaster. You want to have it gradual. You want to have some step-down thinking that is incorporated into what you're doing. What continuity of control means. Continuity and range of services refers to the fact that in some of these facilities, the young people get everything from soup to nuts. And that's maybe fine when they're in the facility, but when they go back out in the community, it's a whole other world, either because of what's paid for, what will be covered, what's existing in the community or not. All of a sudden, a bunch of services either get locked off, or what's provided is a show of what they were getting before. And in that instance, it seems to me, again, particularly for a high risk for reoffending young person, we're really asking for trouble, because if they're really benefiting from a wide range of services, and now exactly at the moment when in the community is most at risk, we now lop off a bunch of those services. When we're changing their setting and context, most people would say that that's absolutely the wrong time to do that. So we need to be very carefully considering what it is that we can potentially do to try to deal with that situation. There are lots of reasons we could talk about as to why that's happening, but in various jurisdictions that others have been working, we focus a lot on that range of service issue, because it's very important from the point of view of comprehensive, holistic, and integrated service provision. With regard to continuity and service content, what that refers to has to do with the fact that, for example, you may be getting a lot of vocational training. The problem is, once they go back out in the community, there's no vocations that actually they're able to enlist any of the training that they received. In cases, the vocational training they get is actually quite dated and isn't something that the industry even uses, particularly when we're thinking about employment. In terms of substance abuse treatment or mental health or education, I could make the same point. That is, if you're going to basically providing a service, maybe they are in fact benefiting from it, and put them in the community and they have real high needs in relation to that service, and now you change it all over, where you're going to go back to square one. This is not a good thing, especially not at a transition point. It's asking for trouble, and I think it jeopardizes public safety, particularly when you're dealing with a high-risk reoffending young person. Continuity of social environment refers to the fact that if they're very isolated, they're very cut off, they have no exposure, and may even max out while they're in the facility, meaning they're not going to be on any form of supervision when they go back out in the community, that is very potentially traumatic. That's very disruptive in potentially for a high risk for reoffending young person may jeopardize public safety as well as their own ability to function and manage. Continuity of social environment is something that there's things that can be done to get more and more exposure on the inside, on the outside. We need to be thinking about that. And then finally, continuity of attachment. What that refers to is linking these young people up with responsible adult models and other peers. In some instances, other peers who've been in their shoes. I can't emphasize enough that in many instances, young people who have gone through this before are very powerful messengers. And yet I know that there's jurisdictions that don't allow that to happen. They actually prohibit it. And I think that we need to be rethinking that, because in many instances, they can be some of our most powerful pieces of communication and influence. In terms of cognitive behavioral approaches and skill training, what I basically say here is that there's two major variants in terms of cognitive behavioral approaches. And these various items that you can see on this slide can be sorted out along these two variants. One is when you've got young people who've got cognitive distortion. That is, their misreading of the cues is something that they need to have a lot of work on. And there's a whole range of cognitive behavioral approaches that deal with focusing on cognitive distortion. Okay, that is very different from a cognitive behavioral orientation to somebody who it's not about misreading cues. This young person may be reading the cues quite well. The problem is that the way they respond to what they're reading quite properly may be very problematic. So it's about managing their anger, handling conflict. It's about developing empathy. Those are the things that are very, very important for somebody who may well not have a cognitive distortion problem. They may be picking up just fine what's going on around them, but the issue issue is that they need some work on impulse control. They've got issues in terms of behavior management and conflict resolution. Those are the kinds of things they want to work with. Very quickly, cognitive behaviorally oriented approaches, I believe it's fair to say, are increasingly being found in a great deal of research by different people in different places and at different times to be absolutely critical in our thinking about how we want to intervene with an offender population. The truth is, this is being used with young people and even others, that is, adults, in many other settings, in many situations, to treat substance abuse, to deal with bereavement, to deal with mental health. So cognitive behavioral oriented approaches from an evidence-based perspective is something you need to be thinking seriously about how it can be incorporated into what you're doing. With regard to overarching case management, there are 5 components. And what I want to do very, very quickly, because time is running short, is just give you a couple of major points to be thinking about with regard to this overarching case management construct. And it's really important because we know that we've got these young people moving from stage 1 to 3B. They move from stage 1 to 3B. Sometimes what happens is they have a different case manager, and you literally have case managers falling over other case managers, and in some cases you actually need a case manager to manage the case managers. It's that complicated and that crazy. So it seems to me that overarching case management is a very critical thing that we need to think about. And if there are multiple case managers or teams of folks who are involved in case management, that's fine. But we've got to be very careful because I've seen many places where there are multiple case managers and they're all case managing it in a totally different way. With respect to assessment and classification, the major point that I want to make is that when we think about assessment and classification, whether we're talking about screening or whether we're talking about assessment, we'd be thinking about the risk of reoffending, or we could be thinking about strengths and assets and resiliency. And those can be very different things. And if we don't focus on both very intentionally and very consciously, sometimes we will not be properly identifying what potentially may be the most important thing that we may want to do with some of these young people. It's extremely important to be thinking not merely about risk of reoffending, but we need to be thinking about strengths and assets. Now, the other thing that happens with assessment and classification a lot is that people get a little confused with respect to others that are items of risk for reoffending and other things that represent risk but not for reoffending. So, for example, you could think about somebody being vulnerable, victimization. It's about their reoffending. It's about their being a victim. You could think about somebody who might run a risk in terms of their mental health state when they go back out in the community, or their substance abuse problem, really in some ways independent of what their risk of reoffending is. It's really important to sort these things out. And the reason for that is the young person who may be at the highest risk of reoffending may well be high need, but a person who is a relatively low risk for reoffending may also be high need. And unfortunately, for various reasons, we get lower risk but high need young people involved in facilities. And it seems to me when we encounter a person who is a low risk for reoffending now, not risk for victimization, not at risk for other things, but at relatively low risk for reoffending, high need, we have to think about intervening with them in a very different way, or we're going to potentially be digging ourselves into a very deep hole. So it may well be that there are also a whole range of needs, and these needs may have very little to do with the likelihood to reoffend. You who are familiar with and experience with this will know that I'm referring to something that's oftentimes called criminogenic need. Those would be needs that actually are associated with reoffending. But there's a whole range of other needs that are not. And the question that we have to ask ourselves is, to what extent are we in a position to work on those things? And if we try to do everything for a young person, are we going to be missing what may be some of the key areas to be working on, both in terms of so-called criminogenic need, that is, those risks that are most directly associated with reoffending, and also, most importantly, the strengths and assets. The last point I want to make about this, and hopefully there'll be times in the future where we could talk a lot more about it, is one mistake that people frequently make is that they misinterpret something they regard as a serious offense as being equivalent to somebody who's actually at high risk for reoffending. And we know quite well from the research that that is not the case. That the severity of the offense that may have brought them to you in and of itself doesn't tell us very much about the risk for reoffending. Now, that's not to, make a statement about whether or not they ought to be in a correctional facility. That's kind of a separate issue. But the fact remains is that we've got young people in these facilities, maybe they're for a quote-unquote serious offense, but it's not because they're at great risk for reoffending. And from a reentry point of view, we want to be able to be thinking about what that means that we should be doing. Because if we think that they're at risk when they're not, that's setting ourselves up for another kind of failure. Okay, let me keep moving on here. With respect to individual case planning, from a community perspective, what I want to say to you is that even with assessment and classification, we're going to need to be thinking about the case planning that we're doing that addresses some of these issues that I have bulleted on this slide. And from a family and community perspective, it means that that case plan that may be initially developed at the point of admission or even before a decision is made as to which facility or residential program the child's going to be going to, what we don't want to have happen is everybody has their own individual case plan. And unfortunately, frequently that's what happens. So we've got like multiple individual case plans. Maybe there's some things in common, maybe there's some things that are not. A number of jurisdictions have worked very hard to create mechanisms that bring the case planning process together so that the folks who are involved on the community side, the family, the young people in the facilities, and various different staff within facilities are going to be looking and thinking about a single case plan. Now, that doesn't mean there are not going to be different aspects of the case plan, that you may have expertise among one group of staff, but it means that everybody kind of needs to kind of know where things are, know how it's going to be interacting with other things that other folks are going to be doing. Because don't pay attention to that, we're going to potentially wind up with a situation that we may be sending mixed messages. We may actually be contradicting some of the very things that could potentially be of most benefit. So from an individual case planning point of view, we really need to think about how we can create a more consolidated plan. There could be multiple pieces to it, but we all need to be on board. We all need to sign off. We all need to have an understanding of what that is. With respect to one point to back up, with respect to a relatively low risk but high need young person, we need to be very, very careful. It may well be that in thinking about everything that we're doing, we may be going overboard. For a low-risk young person, while they may need enhanced service delivery around particular needs that they have, it may well be that from a control and surveillance point of view, that is not what they need. And if we're not careful, we can misclassify and provide too much supervision for someone who needs lesser supervision and create another problem for ourselves, which I'll address in a moment. With regard to surveillance and services, what I want to say is simply to reinforce the point that depending upon the level of risk for reoffending and the extent of both needs that these young people have and just how much work we can do focusing on resiliency and assets and protective factors, we're going to want to create in this plan the proper mix of surveillance and services. And this really follows suit with what I've already said. That is, we need to be very careful that if what we really need is a lot of service delivery and support and advocacy, but not really a whole lot of supervision and monitoring, then we want to make sure that we get right, because otherwise, from a graduated response point of view, we could be making some really big mistakes. And the reason we might be making really big mistakes is got a lot to do with what is referred to, of course, as technical violations and conditions of community release. And graduated responses is a very, very important component of overarching case management. I want to say about that is that it's going to be really, I think, critical that we have a graduated response capability, which simply does not mean graduated consequences or graduated sanctions, but it means that in tandem with graduated incentives and positive reinforcement. If you think about it, when you've got the ability of a young person to gain and earn incentives, you also have the ability to take something away from them. So in fact, even with an incentive or something that's earned, there's a consequence side to it. And a lot of times there's folks that sort of don't see it that way. And in fact, where you can most easily see that is a situation where somebody is saying, well, kids aren't here to be rewarded and given incentives. They're here to be punished. They're not going to, what do you mean incentives or prizes or bonuses or points? Forget it. They're here to be punished. In fact, in some places, that runs so deep that there are prohibitions against spending so much as a nickel on anything that smacks of an incentive. And I've been involved in some jurisdictions where the only way they can do that is they have to go out to kind of an outside organization, a nonprofit, a non-governmental agency, and maybe, just maybe, there can be some funds put up from them to do this. But they actually have prohibitions because why? That's a clear statement that the view is this is about punishment, and that means consequences, and we don't want to hear about incentives and positive reinforcement. I want to submit to you that that represents a very big mistake, that we need to be thinking about a graduated response capability. And what that means, we need to also be thinking about the extent and nature of these conditions that we put on these young people when they go back out into the community. In many instances, what happens is they have sort of the litany of restrictions and prohibitions of things that you won't do, of places you won't be, of people you won't be around, and requirements that you're going to go or be in a program that there may be some real difficulties with having that work out well. These, in some instances, are young people for whom relapse is not going to be that uncommon. And if we're not careful, when they don't follow the conditions, it's going to create a lot of problems for them, and they may wind up revoked and reincarcerated. In some places you can't revoke on the basis of technical violations. In other places you can. But the point that I want to make is that we need to be thinking very carefully about the nature of these conditions. Because oftentimes it's within these conditions that we've essentially set some of these young people up for failure. And in some cases where the conditions are that they're going to go to a place that, quite frankly, is not welcoming to them, or providing something that is completely contradictory, contraindicated to what they need, that they're going to actually go there. You might think about it as not a bad thing that they're not going there. Obviously, you want to have them go somewhere else. You want to deal with it in some other way. But my point is that the issue about the number and type of conditions is really, really important. So these young people, particularly those who are low risk for reoffending, we watch very, very closely because maybe they're on an intensive form of community supervision. It may turn out that they violate the condition that, in some research, is not a marker or predictor of someone who's likely to reoffend, but just to teach a lesson because we're zero tolerant and we have to prove a point, we end up revoking them. And I ask you in that case, what have we achieved? I mean, what accomplished? I mean, there may be instances in which that makes sense, but there's many instances in which we go to that far too fast. And in fact, that's the reason why in a number of places we've got overcrowding of facilities loaded up with technical violators. And the technical violation is actually not an indication that they were going to go and commit more crime, but it's an indication of something else that's gone wrong. But because we maybe have not gone into it in sufficient detail to understand what it is and what we might do as an alternative, we create some new problems for ourselves. I want to just briefly say that from a service brokerage and linkage point of view, you can see that what I'm talking about is thinking of how you can tap into families, thinking about ways in which we can partner with a whole variety of community-based organizations. The faith-based community is a reservoir reservoir, potential and opportunity. In some places we've realized it well. In other places, quite frankly, we have not. And then in terms of public and private sector, clearly something that we need to be thinking about from a procurement point of view. In other words, can we contract out, and what can we contract out for? This slide, second to the last slide, simply points out major obstacles that we've encountered in terms of doing overarching case management, not only from a reentry point of view, but quite frankly, overarching case management into some other things that are done. So you can see that each of these represents a potential constraint. If you go back to that very first slide that I showed you, you'll see there's a whole listing of things about structural problems. Look at this list, and you'll no doubt recognize some of these as being very familiar to you. And this is something that we need to be dealing with. The slide I'm going to show you to do with concluding point. And the concluding point is that we really need to be linking facility and community by way of structure, policy, programs, and practices. And I hope, given what we've been talking about this afternoon, you have a very clear sense of what I mean. And even though there's obviously a lot more detail that we could go into, I hope you have a good enough sense about what I mean by trying to link facility and community in terms of structure, policy, programs, and practices, and how we need to be thinking about making sure that we're doing it at a level at which the particular young person who we're working with is going to benefit from and not end up actually making things worse. And then finally, last point, we need to be very careful of keeping deterrence in check, specifically when it's creating an identifiable impediment to law-abiding self-sufficiency. Some of the very things that we will find that we're doing from a deterrence point of view is actually creating more problems in terms of ultimately helping young people be able to function better and be more law-abiding. And if that's what's happening by virtue of what we're doing with deterrence, you have to ask yourself whether or not that makes any sense. Thank you. I know I'm talking very fast, but I'm trying to cover a lot of material. Much appreciate your time.
Well, thank you for getting so much information and putting it together so concisely for all of us. What to do now is tell you a little bit more. Obviously, we've gone through a lot of information today. As we've mentioned, this is just the first of several webinars that we hope to do throughout the course of this year. And after this year, issues related to juvenile reentry. And so we'd like to tell you more about how you can find out more information through the National Reentry Resource Center about resources that are available and future webinars that we're going to be doing. The screen you're seeing right now is the main website for the National Reentry Resource Center. You've got the link right there. You can see in the top left-hand corner of that screen a little box that says subscribe to our newsletter. That is the best way to find out about new funding opportunities that we find out about in the area of reentry, about new webinars that we're hosting, and about other publications and resources that we make available online. So if you haven't yet, please go online and sign up for our newsletter. We are also working on building a library of materials on our website, including just about everything that has been written in the field of juvenile reentry. And we're also working on taking all that information because there is a fair amount of it out there now, and really highlighting the most useful resources for you and trying to find program examples that we can point you to and specific publications that will be most helpful to you as you're developing your program. The very beginning of this effort is our juveniles topic page on the National Reentry Resource Center website, and that's what you're seeing on your screen right now. If you go to that site, you will see a listing of about 9 publications that we consider to be sort of key resources that can help you in different areas that you may be working. And so we really recommend that being sort of the first stop that you go to find out what we've got available online. In addition to that, we are also building, as I said, a really comprehensive library of materials, not just on juvenile reentry, but throughout the field of reentry. And so if you go to our library, which is the screen and the link that you're seeing right now, there is just about every publication we can find on juvenile reentry and adult reentry more broadly. So please, if you haven't yet, take a look at these 3 websites, sign up for our newsletter, and if you have any suggestions for our website, please feel free to send them to us. We are constantly working to improve our website and would really love to hear from practitioners in the field as to what would be most useful to you. And there is contact information at the very end of this presentation today. We'd like to open this up to your questions and answers. If you haven't yet submitted questions, please go ahead and do so in the Q&A box, and we're going to get to as many as we can in the last 10 or 15 minutes or so. Start with a few clarifying questions, and I'm going to send the first one to myself. We've had some questions from some folks about, if there's a particular solicitation or request for funding that this webinar addresses. And this webinar is intended to be sort of an overview of all of the issues that go into designing and developing a reentry initiative for juveniles returning from out-of-home placement. It is not specifically tied to any solicitation, but with that in mind, most of you should know, and I hope all of you will take a look at the second chance solicitations that are coming out right now. The very first solicitation that has come out is for Second Chance Act reentry demonstration projects. There was a joint solicitation released in December for both adult and juvenile reentry demonstration projects. I'm going to post the URL for that solicitation in just a moment in the chat box. What went through in this webinar is not tied to the grant requirements or anything like that. We have a webinar just a couple of weeks ago on that grant program, and an archive of that webinar is available on our website if you'd like to download and listen to it. So we have much more information about that grant program available on our website that we hope you will take a look at if you are interested in the Second Chance Act funding opportunities. There will be more Second Chance funding opportunities for juvenile reentry coming out later this spring. And again, the very best way to make sure you hear about those as soon as they come out is to sign up for our National Reentry Resource Center newsletter. So with that, I want to pose our panelists some of the questions that have come up through the Q&A box. First, a couple of clarifying questions. David, on one of the slides, I think you mentioned a therapeutic community. Can you provide a definition for what that is?
Sure. Therapeutic communities comes out of, originally it was a concept that was very popular in the 60s with Synanon, and then ultimately sort of got morphed into some other types of interventions. But it tends to be a very intensive, residential, some instances quite confrontational, but not always, approach to intervening with both young people and some not so young people that have a whole variety of issues. Some are involved with the justice system, some have serious substance abuse problems, some have other mental health issues. But essentially, the therapeutic community concept, and there's a good deal written on it, and if you Google therapeutic community, you'll just be inundated with literature that describes sort of different therapeutic community approaches, but in common to all of them tends to be highly structured, highly regimented, highly accountable-oriented group process that things go on 24/7, and sometimes there are encounter sessions that go on all night long.
Okay, we've received quite a few questions about, how to address the challenges of juvenile reentry in the difficult fiscal climate that a lot of states and local governments are facing. I'm just going to read a question from one of our participants who puts it very well. Community support systems are revenue-starved. Continuity of service content is problematic in most cases. Do you have any thoughts as to how practitioners in the field can get community-based programs and systems to work collaboratively and perhaps even revenue share? Or any other ideas about how those in the field can develop a sound program while with the difficult fiscal circumstances that many of them are in.
You want to shot at that?
Yeah, and I want to advocate for the multi-system or cross-system approach, Leah, in responding to that question. I don't think it's an easy answer in this fiscal environment, but that if the Juvenile Justice Agency or if the Department of Corrections views its work in a silo and having to deal with the variety of issues around educational supports and behavioral health supports without enlisting that stakeholder group that David has inherently referenced in his PowerPoint, and that I talked about early on, they weren't creating cost efficiencies in how we do this work. I think the other thing is that we look at the issue of institutionalization of young people and the acknowledgement that, just as David talked about, too frequently using violations, technical violations, and incarcerating young people, we need to be thinking about using more community-based options in our dispositional toolkit in the juvenile justice system. That means working with the prosecutors, the judges, and the various probation and correctional officials to make that full continuum exists. It also means that when you accomplish that reduction and institutionalization of the population, that you are reinvesting those dollars. It may be a zero-sum game, but you're reinvesting those dollars in other fee-based services, including reentry services, so kids don't come back into the system. I know this is I make it sound easier than it actually is. The reality is it is happening in different jurisdictions, and I hope that we highlight some of those things that are taking place around the country through the work of the Reentry Resource Center.
Great. We'll move on to a question that we also got in several different forms from many of the folks who are on the call today. And that is, if you're a practitioner in the field, how can you be sure that you are adhering to an evidence-based model or identifying practices that sort of fall in a category of best practices? And before you jump in, I want to say just one thing about what we have. One of the projects that we're working on at the National Reentry Resource Center, which is a What Works library. As we mentioned earlier in this call, there's a whole world of information out there about reentry these days. And what we're really trying to do, in addition to getting all of that information in one place so you can find it easily, is also trying to highlight those practices or programs that have the best evidence behind them. And so over the course of the next year or so, the National Reentry Resource Center is working with the Urban Institute, John Jay College, and a number of other folks to really highlight the promising practices and evidence-based models. So much more information about that available on our website over the course of the next year or so. But Shay, do you have anything to say about that right now, about how these can go about making sure that they're identifying the best models or practices to adopt in the community?
Sure, I could. Let me just quickly add to what Leah said, that there are numerous reports, documents, and groups that are focused on identifying and discussing evidence-based practice. And there are multiple registries. Different federal agencies, for example, actually go on their websites. You can look up, they have registries of what they regard as evidence-based practice. So one of the things that, as Leah indicated, that the National Reentry Resource Center is going to do is to try to sort of compile this for you, because it can be a little bit bewildering, quite frankly, and there's lots of different things out there. But there's really no lack of information about it. It's just that it's spread all over the place. So one of the things through this project that Leah was describing with the Urban Institute is we're going to try to sort of pull that all together for you and then have it available through the website so that you can take a look at it. But independent of that, you can go out there through various organizations as well as federal agencies, and in some cases state agencies, see what they're listing as evidence-based practice and what kind of information they provide.
The thing I would add to that is that while we don't identify the evidence-based practices or programs, we also want to acknowledge what you highlighted at one point in your presentation. We need to make sure that our workforce is ready and able to implement those programs. Right. And simply buying a package and saying, well, we're going to implement XYZ program, doesn't account for what training of staff, supervision of staff, quality control around implementation, and measurement of outcomes, both short-term and long-term, that you would expect from that program. I think we need to also be talking about not just the evidence-based programs, but the evidence-based environment in which an agency needs to operate to effectively use those programs or practices.
Good. I couldn't agree with you more. It occurs to me just one in particular that I was recently looking at, and there are many. If you go on the website for SAMHSA, Substance Abuse and Mental Health Services Administration, they have quite a, on their website, they have quite a lot of information on what they're regarding as evidence-based practice, and it breaks it down by population, so you can kind of look up under juvenile and offender and see what they're listing. And particularly from a mental health and substance abuse service point of view, you might find that to be somewhat illuminating.
Okay, we received a number of questions about two particular issues that that many youth face when they're returning from out-of-home placement. That is, on the one hand, the educational needs of youth returning from detention and reintegrating them into the school system in their home communities. And then the flip side of that coin is youth going back to the community, trying to enter the workforce. Do you have any suggestions about how folks in the community can work with their home school districts or those in their communities to improve school reentry for those going back, first of all?
Want to take a shot at it?
Sure. And I think this is one of those stakeholder group issues, Leah, that we need to have the educational officials in the community, some of the educational leaders and community members at the table talking about this issue, the barriers to reentry around education, the ability to effectively document the educational gains of the young people while in care, and then well before their release be communicating with the schools about the reentry of the young person and having an appropriate educational plan for that reentry. In too many instances, the kids go back home in reentry phase. They report to their parole officer or probation officer, and the accountability is that they are supposed to enroll in school the next day or whatever the next school day might be. And that young person doesn't have that pathway paved for them, both by the worker assigned to the young person and by someone at the school ready to receive them and try to put the elements into place that could help them succeed. A lot of times in the current environment around zero tolerance, around the performance standards of Leave No Child Behind, these kind of conversations, advanced planning, are even more essential than they were 2 or 3 years ago. I would strongly advocate that no good reentry work can be done. And in the stakeholder group helping to plan for it are the educational representatives who are helping to kind of pave that pathway.
To that, the Department of Education, Shay knows this, is working on this whole question of not young people who come out of neglect and abuse situations, but also come out of correctional facilities. And there's a whole effort within the Department of Education just focused on that. The other thing I would point out is that if you go to the website that you mentioned under juveniles and then key resources, the third item, you'll see something called Educational Aftercare and Reintegration Toolkit for Juvenile Justice Professionals. This is a product of the Education Law Center in Pennsylvania, and what may not be target for every place around the country, it still might be illustrative for you and some things you might be thinking about.
The resource David talked about from the Department of Education is the NDTAC Resource Center, which can be found online at their website.
Okay, so the flip side of that educational question that we've been receiving is questions from folks about how we can improve employment prospects for youth when they're returning to the community. Specifically, there were some questions about how we build relationships and partnerships with employers and communities to help those youth who are returning and hoping to enter the workforce. Any suggestions on that?
Let me just say that I'm glad you asked about that. The Department of Labor, through the Employment and Training Administration, ETA, if you get the website DOLETA, DOLETA, and go to the youth office, they've actually been working on this whole question around employment-centered reentry for quite a long number of years. I've had some involvement with this group on a couple different initiatives, and they have spent a great deal of time and have amassed a large body of information on this whole question about employment-centered reentry services. So we're fortunate that for a while now they've been doing this, and I would encourage you to go to the Department of Labor's website in reentry, and you will get reference to some of the things they've done more recently and some of the things they did as long as like 8 or 9 years ago. This whole question about what it takes from an employment point of view to get these young people in a much better situation, because from a youth employment point of view and career development, there's real big problems, not the least of which, as we all know, is that there are prohibitions and restrictions that sometimes actually make it very, very difficult for the young people to get gainful employment, when we know that that is going to be at least part of what is going to be so important for them to be able to be self-sufficient and law-abiding.
David, I'm going to add that I think the listeners in the audience who are linked into their state legislatures, their governor's offices, any local governmental entity that has put up some of those barriers, well, being able to access scholarship money or tuition supports when they have a record, need to revisit some of those laws that put barriers in these kids' ways that really prevent them from getting back on a law-abiding path.
Great point.
We are running close to being out of time on today's webinar. We're actually a little over, so thank you all for staying with us on the call today. I'm going to, sort of just at my discretion, pick the last question. It's one that's come up a few times. David, for many of the programs that you've talked about and the matrix that you presented earlier in the webinar, do you have a specific timeline in mind for when the different programs should start in terms of life skills, vocational training, any of the other programs that folks in the field might be trying to implement? Is there a specific timeline?
That's a question that I actually get a lot. People are kind of looking for, at what point and for how long. And quite honestly, I'm not sure we really have good information on that. I guess my view about it is, and this is consistent with what I've been saying all along, is you want to start it early, especially if you may not be in a position once there's been a release to have involvement in a formal sense for very long. You therefore want to start it as early as you possibly can. So I like to get things going early on after admission into a facility, and then to the extent that it can be continued when you go out, all the better. In some cases, it may be part of while young people are still under some form of supervision. In other instances, it's not going to be about that. It's going to be that there's some real value that young people see with regard to being involved in some of these things, and they want to stay with them, and they find it helpful. So I can't give you an exact number, but I would say to you, starting very early and then seeing if they would be willing to stay with it even after there was presumably no requirement to do so, and finding places that have other funding or other views about continuing to provide services, because sometimes the financing becomes a real constraint in that regard.
I'll add one additional piece to this, and it isn't necessarily a direct answer to the question, but it is a suggestion for the sites, and that is to think about taking a look at your reentry population, so the population of young people leaving institutions, going back into community, and begin to collect data about who they are, looking at assessments that were done on those kids, who are the low, moderate to high-risk kids across different types of offending. How long are they staying in the entry process? How long are they on parole? And at some point, is your data showing you that some of that length of time on supervision is actually becoming counterproductive, as opposed to the type of voluntary services that they can transition to that not lead to some of the technical violations that plague a lot of our kids. A lot of these kids are going through normal adolescent development, and some of the things that we do in terms of the tight supervision, when it lasts too long, actually becomes counterproductive, as opposed to the reentry supports we want to see instituted that help them transition back into the community.
Great. With that, I think we have run out of our time for today. I want to thank you all for your attendance and participation, and especially thank the Department of Justice and OJJDP for sponsoring our webinar today. Great big thank you to our two speakers today, Shay Bilchik and David Altschuler. What you see on your screen right now is my contact information at the National Reentry Resource Center. We're really sorry that we weren't able to get to all of the questions that were asked today. We had a lot of content to get through, as you saw. But if you have additional questions that you'd like to send my way or send to the speakers, please feel free to contact me. A recording of this presentation and the slides will be available online within the next few days. We will send you an announcement just as soon as those slides are available online. The PowerPoints are already available online at a link that appears in your chat box, so please feel free to go ahead and download those. Finally, when you leave this event today, a brief survey about this webinar will pop up on your screen. We are new here at the National Reentry Resource Center. We are continually looking to improve, and so we would really appreciate any feedback you can give us about this webinar, about future webinars that you would like to see us put on in the coming months, and anything else that you'd like to see us working on here at the Resource Center. With that, I'd like to thank you all very much for participating. Give a great big thank you to our speakers today, and thank you all for your time.
Bye-bye. Thank you.
Thanks, Leah.